Okay, now I will talk about the evaluation of chest pain. Okay, so before I talk about the evaluation of chest pain, I must talk about pretest probability of coronary artery disease with a high, intermediate, and low risk. Okay, so let us say in high pretest probability, there are two things that you need to remember, and there are two numbers, 40 and 60. Okay, so 40 and 60 the magic number over here. So typical angina in men is more than or equal to 40, and typical angina in women is more than or equal to 60 falls under high pretest probability. And intermediate or typical angina in men of all ages, or typical angina in women of age more than 50. Why? Because or typical chest pain in women less than 50 was in low grade. Okay, remember that. Okay, and typical angina in women with age 30 to 50. So these people are falls under the intermediate pretest probability of CAD. Okay, and low risk are those with asymptomatic people of all ages, or atypical chest pain in women with less than 50. Now if there is a pretest probability of coronary artery disease is low, then no additional diagnostic testing is required. But if it is intermediate, then you should ask yourself whether the patient is able to exercise or not. If yes, then you do ECG, and if then there is normal ECG, then you will do exercise ECG test. If the ECG is not normal, then you can do exercise imaging test, uh, and if either of them are positive, you can do coronary angiography. Now let us say the patient was not able to exercise, you can do pharmacological stress imaging test followed by coronary angiography. Okay, and those people with high pretest probability of coronary artery disease, you can start pharmacology therapy for CAD right away and do expert evaluation. So what are the typical and classic symptom that I have been talking about? So typical location, that is substernal, and quality and duration of the chest pain provoked by exercise or emotional stress and relieved by rest or nitroglycerin are classic features of angina. If atypical are those with any two of the three characteristics of a classic angina, but not the third one. So that is atypical variant. But non-anginal are those with any chest pain less than two of the above mentioned three characteristic of classic angina. Okay, so if it is less than 2, then that is non-anginal. Okay, so this was all that you need to know about the evaluation of chest pain. Just go through what are the low risk, low pretest probability, intermediate pretest probability, and high pretest probability. Don't forget the magic number 40 and 60 for typical angina in men and women respectively. And yeah, that's it.